We shall move on to the section on flash talks, where small topics shall be covered by 5 speakers. May I kindly invite Professor Dr B.K. Choudhury and Dr. Manomohan Biswas to chair this session. Dr. Arindam Ghosh to speak on sarcopenia, on its diagnosis, and then we shall follow the same order. It will be followed by Bell's palsy, role of magnesium, vaccinations, etc.
We'll start the flash talk. Flash talk means very short duration, high impact topic, which gives us to discuss further. And the first speaker is Dr. Arindam Ghosh, consultant physiatrist, Yavana Clinic, Kolkata.
So, good afternoon and thank you for having me today. I'm going to speak on sarcopenia. Sarcopenia means loss of muscle mass and quality, and it recently get an ICD code. After 2010, European Working Group on Sarcopenia's first definition. Lots of paper are flooded on this, and we are describing it on basis of Asian Working Group on Sarcopenia consensus guideline because of our similar body habitus and similar anthropometric measurement. We will use their guideline only, and it has 3 points: low muscle strength, low muscle quality or quantity, and low physical performance. Presence of only low muscle strength is possible diagnosis of sarcopenia that we do in primary care, and presence of both low muscle strength and low muscle quality or quantity means confirmatory diagnosis. And along with that, if there is presence of low physical performance, then it tells about severity of this disease. And here I have highlighted one point, that is age related. Although sarcopenia is 2 types, one is primary, that is age related, and one is secondary, that is because of some underlying comorbidity. But as Asian Working Group do not have separate guideline for them, we are using only age related, that is primary sarcopenia, to define them. And in epidemiology it has near about 5.1 to 25.7% prevalence from pooled data with male predominance, and it has very high social, personal and economic burden. And risk factors are poor nutrition and dental status, inactivity, osteoporosis and cardiometabolic diseases. And it increases high chance of fall and fracture, and high chance of cardiorespiratory disease, cognitive impairment and deranged ADL. So in diagnostic criteria, we use generally find, assess, confirm and severity algorithm. So in case finding in community level, we usually measure cup circumference in maximum cup circumference with tape, measuring tape, and the cutoff value is 34 centimeter for male and 33 centimeter for female. Or there are 2 separate score, easy to use score. One is Sarc-F and one is Sarc-Cup. Sarc-Cup is only Sarc-F along with cup maximum cup circumference, and the cutoff are 4 and 11 centimeter. This is Sarc-F screening tool. Here we measure strength, assistance in walking, rise from a chair, climb stairs and falls. Each has 2 maximum 2 score, and total number of score is 10. And to assess muscle strength, separate guideline is there. For spring type dynamometer, we have to measure it with full elbow extension, and for hydraulic type, patient must be seated with 90 degree of elbow flexion, and at least 2 trials or at least 2 readings with either both or dominant hand, and cutoff value is 28 kg for male and 18 kg for female. And for measurement of muscle quality and quantity, actually we measure quantity here only. Only appendicular skeletal muscle mass we calculate by either dual energy X-ray absorptiometry and or bioelectric impedance analysis, which must be multi-frequency device. And the cutoff values are for male less than 7 and for female less than 5.7. Although CT, MRI, USG can be used to assess quality of muscles, but no consensus is there in Asian guideline. And regarding physical performance severity, we use 6-meter walking speed, which cutoff is less than 1 meter per second, or 5-time chair stand test more than 12 seconds, or there is a battery called short physical performance battery, and this value, cutoff value is less than 9. And this is short physical performance battery. Here actually first we have to assess side by side stand, then semi-tandem stand, then tandem stand. Each both side by side and semi-tandem stand maximum score is 1, then tandem stand maximum score is 2. Then we have to assess gait speed and then chair stand test. Thank you for listening.